Hello, good afternoon. Doctors in Birmingham say the number of serious complications from obesity surgery carried out abroad is spiralling out of control. Rishi Singhal, a surgeon at Heartlands Hospital, says he's seen 3 patients in the last week alone to discuss the need for treatment. And neurologist David Nicholl, who works at the same trust, has described the situation as the Wild West after seeing 2 patients who were experiencing malnutrition following obesity surgery. Our health correspondent Michele Paduano reports.
Medications have to be made up and given via a tube, including morphine 6 times a day for the pain. Ever since Pinky Jolly had her operation in Turkey in November 22, she can't eat. She spent 3 months in an NHS hospital on antibiotics, had 6 endoscopies, 8 CT scans and a further operation, but she's still suffering.
I haven't tried to eat anything for about a year, but when I did, it was that searing pain really high up, and it felt like it was just stuck there and it wouldn't go down. And at the time, I had a drain and a drain bag, and the food came out.
Pinky has travelled from Liverpool to see if a Birmingham surgeon can do anything, after surgeons there are reluctant to operate because it would be complex and potentially life-threatening. Pinky's £2,100 cut price operation in Turkey has already cost the NHS £100,000 in treatment, but it's cost her family even more.
A lot of the time I feel helpless because she's in so much pain. I can't do anything about the pain. We can just keep trying to go through the pain management.
When bariatric surgery works, as in the case of Rachel Murray, the results can be impressive, but a UK operation costs around £10,000. Doctors believe the £2,100 Pinky paid would not even cover the consumable equipment here.
10 years ago, when I started as a consultant in bariatric surgery, I was probably seeing 1 or 2 patients a year that had surgery outside UK, bariatric surgery, and had a minor complication. Now we are seeing, 2 to 3 patients a week sometimes who've had a severe complication of bariatric surgery that has been performed overseas.
Dr. David Nicholl is a brain specialist at the same hospital. In 20 years, he'd never seen a patient suffering nerve damage caused by nutrition. In the last week, he's seen 2.
I think it's very worrying because this is a complete Wild West. You could say, well, buyer beware. You know, if you go on TikTok or, watch something on Instagram and get sucked into that advert, you may be getting health advice which is wrong.
Doctors think it can't be stopped, so it needs better regulating. Pinky's advice is don't do it, however cheap it may seem. Michele Paduano, BBC News Today.
Now, a raft of get well messages to King Charles have been